Interesting, different, unusual. My kids tell me about that I'm like that. And I'd like to start by saying welcome today. It's my pleasure on behalf of MS Australia and our advocacy team to reintroduce and showcase some of the advocacy work that we've completed or we're completing right now. Remember, interesting, different, unusual. That's my sphere. That's the nature of advocacy and it's the nature of MS. MS Australia's overall aim is to supercharge the MS research agenda and seek vital funding in our research activities to better treat, prevent, and obviously ultimately find the elusive cure for MS. Through our advocacy, we empower you, the researchers, we hope, to identify ways to treat, prevent, and cure MS. We advocate for an increased focus on research, better treatments for people with MS, including things like disease-modifying therapies that have been talked about today on the PBS. We do this through a range of mediums, including seeking funding from government, philanthropic organisations, our state member organisations throughout the nation, the general public, and including initiatives like the May 50K. We advocate through many channels, including submissions to relevant public consultations and inquiries, face-to-face meetings, participations in forums, workshops and conferences. We also collaborate, as has been mentioned, with various global strategic alliances and memberships on research advocacy, including MSIF, the Multiple Sclerosis International Federation, the International Progressive MS Alliance, and the MS Brain Health Time Matters in MS Global Health Initiative. NDIS campaign. Most of us are familiar with the NDIS. As the nation's peak MS organisation, it's crucial that our advocacy is visible to leaders, to decision makers, to the public and to the community that we owe the acknowledgement to proudly represent. June last year, MS Australia launched our campaign, A Better NDIS for People Living with MS, and this was to advocate for improvements to the NDIS and for us that live with MS. In December last year, MS Australia provided a submission to the NDIS review, which built on over a decade's worth of NDIS submissions and policy work. This identified 6 essential areas for reform and policy solutions. Our NDIS campaign mirrored these 6 areas for reform. They included Hear Our Voice, Understand MS, Timely NDIS Access, Early Intervention, A Helping Hand, Assistive Technology and Accommodation, Life-Changing Care, MS Nurses, Don't Discriminate, Age of all things should not be a barrier, Inclusive and Equitable Disability Care, Care beyond the NDIS. The campaign was informed, shaped and strengthened by input, feedback and advice by all our MS member organisations, MS Plus, MS Queensland, MS SA and NT and MSWA, and from Australians all living with MS. MS Australia is now asking people to join us in calling for these reforms by signing our letter of support to the NDIS Review Panel co-chairs, Professor Bruce Monaghan and Ms Lisa Paul. MS Australia has also commissioned KPMG to undertake a health economic impact analysis of early and appropriate access to support services for people living with MS. This report will form the basis of MS Australia's second submission to the NDIS review and should provide evidence of the economic benefits of access to the NDIS. Here last year we spoke about the MS Nurse Care in Australia report created by MS Australia in collaboration with you, the Menzies Institute for Medical Research, and MS Nurses Australasia, the MSNA. Following the release of this landmark report, MS Australia formed the MS Nurses Working Group made up of MS nurses and people with MS to provide some direction and input on implementing the recommendations of this timely report. This includes looking at how to increase the number of MS nurses across the nation, increase access to MS nurses, assist the existing MS nurse workforce, wherever they might be, raise awareness of MS nurses, and absolutely demonstrate the life-changing care that an MS nurse provides us, if you've got one, and if you live somewhere where there is one. MS Australia has also met with the Federal Health Minister, Mark Butler, Assistant Minister for Health, Jed Kearney, and Department of Health and Ageing to discuss MS nurses. So we're moving on this. On World MS Day next Tuesday, the 30th of May, MS Australia, we are holding a Parliamentary Friends of MS breakfast at Parliament House in Canberra, the theme of which is MS nurses and their life-changing care. This will be accompanied by a release of a media campaign that includes video interviews with MS nurses and patients talking about and bringing to life the impactful, crucial and absolutely beneficial work of all MS nurses. MS Video. MS Australia's What is MS Video is a new educational resource produced to demystify and to explain MS, commissioned in 2022 by MS Australia to mark its 50th anniversary year. The video What is MS educates the public and people living with MS, especially for you if you're newly diagnosed, about the cause, the different types of MS and the common symptoms. Most people in Australia know what MS means, but they don't necessarily have a very good understanding of what it's all about. This educational resource will ensure employers, family carers and others in the community have a better understanding of how MS impacts on us living with the condition. I was fortunate to be on site during the filming of as the lived experience advisor to provide advice to the production crew to ensure an accurate portrayal of MS in real life on the screen. If you go to our website, you can also watch a video that takes you behind the scenes of the video production or listen to one of our latest podcast episodes released earlier this week that does a deep dive discussion into why this resource, the What is MS Video, is so relevant and so vitally important. From videos to podcasts, in 2022, as has been mentioned already, MS Australia started the podcast The Raw Nerve. The podcast provides a conversation space for all things MS, and there have been 11 episodes to date. The podcast covers news and views on latest research, treatments and advocacy efforts, as well as candid and informative interviews with our community, those folk living with MS, their families, carers, together with leading clinicians, researchers and advocates. Episodes are co-hosted by our CEO, Rowan Greenland, and veteran radio broadcaster Phil O'Neill. And for those of us that are old enough, we remember Phil O'Neill from years ago, Ugly Phil. And interestingly, and to our absolute direct benefit, on one hand, Phil was diagnosed in 2016 with MS himself, and only last year spoke publicly and very openly about his MS journey for the very first time. Guests to date have included Australian Paralympic cyclist and gold medalist Emily Petricola and lead singer of Everclear, Art Alexis, and mountain climber Jennifer Willis, who lives with MS and has just completed recently an amazing expedition to the Himalayas. Our lived experience expert panel, I'm very proud and delighted to showcase this next initiative MS Australia has recently established, a living experience expert panel, or LEAP, to provide expert advice on core areas of interest to us at MS Australia. The LEAP will provide a formal mechanism to access advice from experts across the MS community and support all work of MS Australia. This will ensure the MS community has a strong voice into MS Australia's governance, its research, its policy, its advocacy, its education and its awareness. We're currently calling for applications for membership from interested folk, and I know MS Australia to date is delighted by strong interest in this panel. Members of the LEAP will be selected for their capacity to assist us in achieving the purpose of the LEAP and to provide meaningful feedback and input and contribution to MS Australia's policy, research and communications work. LEAP members, we hope, will be able to provide input and advice on areas of expertise or interest to MS Australia, as outlined in our deep terms of reference. If you happen to know anyone, or if you might be interested and you could make a valuable contribution to the LEAP, you can do our online LEAP application form or reach out to some of our advocacy team that are with us today. Applications close on Friday 16 June. Keeping our finger on the pulse. MS Australia's lived experience advocacy efforts are broad, and with the establishment of the LEAF will even greater depth going forward. Lived experience of MS is embedded on our board of directors, within our member organisations and within the ranks of our National Advocates Program. As we continue to consult, partner, engage with the broader MS community, both formally and informally across the entire organisation. As a person living with MS myself, I provide crucial lived experience and input into the work of the MS Australia Advocacy team. So how do I know what the major issues are for you, the MS community? I'm only one. I'm involved in 3 different peer support networks of people living with MS across the nation. I coordinate a team of 15 national volunteer advocates all living with or supporting someone with MS. I'm an NDIS participant with all the challenges that brings. I represent MS consumers and people with lived experience in a range of things, and this includes local government. In my region at Central Coast Council, I'm a member of the Access and Inclusion Working Group. As you would know, I'm part of the Menzies Community and Consumer Reference Group. I'm linked in with the Tas Health Service, and I'm part of their Consumer and Community Engagement Council with Quality Patient Safety Services. I'm linked with various pharmaceutical companies on consultative and advisory councils. And I also regularly meet with our elected representatives, both federally and local MPs and senators. I'd like to take this opportunity to acknowledge the other members of the MS Australia Advocacy team that are here. We've got Jeremy Henderson, who's here. We've got Katie Snell, who's here, and the other folk are listed there. Sarah Clifton is a new person with us, and she's our Senior Policy Officer, and it's disappointing she's not with us today, but there you go, there's a snapshot of who the folk are. I've highlighted our work today, and I think in the truest sense it's our collective work. I'm proud to be part of an organisation that collaborates well, drawing in expertise and passion both internally and externally in an effort to best serve and support you, the MS community. I said it was interesting, different and unusual. That's what advocacy is. My role is to make a positive difference. Thank you for listening to me.